Health visitors are really important to deliver because they're skilled in public health. They are skilled in recognising the needs of children, babies, young families, and they're actually skilled in being able to find the tools, techniques and support to enable young mothers, young families, young parents to look after their children in the best possible way and give those children the best opportunity.
I became a health visitor by default really. I was doing my nurse training. I'd previously been a nursery nurse and really wanted something that fit in with family life, and I absolutely loved it and luckily progressed to where I am today. I'm team leader for approximately about 26 staff. I share it with a colleague and we've been in post perhaps for about 3 years, and the reason the post was developed was to really improve services to local families and communities and actually raise the standard of health visiting.
In my nurse training, I did 7 weeks in my first year of my nurse training with the health visiting team, and I really enjoyed it. I enjoyed working with mums, I enjoyed working with families, and I think it was that sharing of knowledge that I really liked and I found that really interesting. The health visitor training was a really challenging year. It was assignment after assignment, lots of exams. It was intense and it was deadline after deadline, but it was really good. It was worth it. I'm glad that I've done it. We might have a clinic in the morning, so mums come in, get babies weighed. There might be a number of problems that mums ask you questions about at the clinic. We'll be working out in the community, maybe in the afternoon, going to mums' houses and seeing new babies. We'll identify what the mums and families' health needs are, and then we'll provide the services to support the mum.
There's a greater expectation and a greater public policy demand of health visiting, which means that can't be delivered unless we are supported to do so. So I think that's going to happen. I think it already is happening. Really, it's a good time to come into the profession.
Services we offer locally, again, are governed by the Healthy Child programme, which we're actually currently working to nationally. We have a lot of local input into the children's centres. So the strong links that we have with Barnardo's have been helpful to actually do a lot of joint working. So we might look at developing courses around toddlers, baby massage, infant massage. We might look at maternal mental health issues and how we support that. We work very closely with the midwives and provide breastfeeding workshops and clinics and support really.
I think how important the health visitor is varies from one family to another, so it goes across the whole range. For some families, they shouldn't not know why the health visitor is here. It should be pretty obvious, but their need for the health visitor intervention is probably minimal. Everything's okay, they're very autonomous, they get on with their lives, and the child is healthy. But for some families it's quite the opposite of all that, and the intervention of the health visitor can be vital.
The role to the families I serve, again, is very individual, because families they're all unique. That we can't go into one family and do the same thing each time we go in. Their needs are different. So, for instance, we might go to a young person who is living with their parents, and the needs of that family have to be tailored to what they want from us, really. So it changes on a day-by-day basis.
It's a privilege and it's also a responsibility to be able to have some influence over how children and families function and how they live their lives. I'm not overstating our input. Sometimes we don't have as much input as we'd like to have, but we definitely have a role to play, and that's a real privilege to be part of people's lives. I think health visitors are appreciated. I think certainly if you talk to families that have had a good experience of health visitors or have been supported by health visitors, they will speak very positively about the experiences that they've had, and certainly for many families it's vital.
I work in a team where I'm really well supported, so I can always ask the members of the team for their support, and their advice, bounce ideas off each other. I learn something new every day. There's always lots to learn. I think you need to be good with people. You're going into people's homes, you're asking lots of questions, and sometimes they're quite difficult questions to ask.
I think when the health visiting is working well, then you're recognised as a resource, not just for that family, but for the community, and the people, in a sense, you get information that people think you should know this about such a thing, and did you know this? Or you become a source of information.
When I think of myself as a health visitor, I don't think of myself as a male health visitor, and neither do I think any of my colleagues or families that I work with. I'm Andrew, who is a health visitor. So if you're good at engaging with people, if you want to work with communities and feel that you can make a difference, then come. It's a good time to be one, and you'll enjoy it.